Hi! So this video is about achieving the cleanest, healthiest smile but in the simplest way, plus top tips from a dental hygienist. So if you'd like to learn to brush like a pro, keep watching. Hi, welcome to my channel. My name's Leanne and this video is about keeping it simple. There are so many oral hygiene products on the market and there's different advice on how to use them. It's like, where do we start? Well, I'll tell you where, right here. So I'm going to show you a really simple two-part daily routine to keep your teeth nice and clean and healthy at home using just 3 products that you've probably already got. So there's your toothbrush, your toothpaste and your floss. That's it. I will be going over other oral hygiene products in my upcoming videos, so subscribe me and keep a lookout for those. So, what's first? Now, you may be surprised to learn that it's actually advised that we floss before we brush. I know, it's not how they do it in the movies. But the logic behind it is basically when we floss, we remove any plaque, any food debris that might be in between our teeth. And when we then brush afterwards, those areas are now accessible to our toothbrush and more specifically to our toothpaste. So the fluoride in our toothpaste is able to get into those little gaps and work its magic, strengthening the enamel and preventing tooth decay. So it always makes sense when somebody says it out loud, doesn't it? Now, there is no harm in flossing after you brush, if that's how you're used to doing it, if that's how you prefer doing it. There's no harm in doing it that way. It's just not as effective as doing it first. But maybe give it a try. You might like it. Okay, let's floss. So you're going to need about 30 or 40 centimetres of floss and you want to wrap it around your middle fingers. Not too tight or you will lose feeling in the tips of your fingers. So you want to get yourself about maybe an inch of floss between your thumbs to work with. Yes, I did just casually switch between metric and imperial, sorry about that. So about an inch of floss between your thumbs, whatever gives you the most control. You may find it easier with your fingers than your thumbs, but see how you feel most comfortable. What you want to do, I will demonstrate in a moment on myself, but what you want to do is push it up between the teeth, create like a C shape around the tooth, give the tooth a hug, and then scoop down, and then push it back up the other side, give that side a hug, scoop down. I know scoop might sound a bit gross, but essentially that is what we're trying to do. We're trying to scrape that plaque off, we're going to scoop it away. So yeah, let's have a little go in the mouth. Go up, give the tooth a hug, scoop down, and then up the other side. Give the tooth a hug and scoop down. A really important step that so many people forget, but it's so important. After you've done one tooth, move down to a clean inch of floss. Please don't use the same inch of floss for the whole mouth. I mean, for a start, if you're going to use the same inch of floss, there's no point in having 40 centimetres of it wrapped around your fingers. But also, you're just going to be moving plaque from here to here to here to here to here. So, it's really a waste of time. So make sure you've got a nice clean piece of floss ready for each tooth and you're all set. One of the reasons why my patients tell me they're reluctant to floss is because they feel that their teeth are too tight together, sometimes overlapping even, and they just really struggle to get that floss in there without hurting themselves. So if this is you, give it a try, do persevere. Just trying moving it down in like a gentle sawing motion can sometimes be enough. So let me try and demonstrate. Ha 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 ha. Was that clear? So basically all I was doing was just this gentle sort of a back and forth motion as I was easing the floss down. This is why it's important to make sure you've got a good comfortable grip on the floss because it'll be much easier to control it. Whereas if you've got a loose grip on it, you're more likely to just snap it down and hurt your gums. So give that a try if you're struggling to get the floss down. Try the gentle sawing motion. I mean, if that still doesn't work for you, if you still just can't get it in there, it could mean that you might just need a different oral hygiene aid. So maybe something like a dental tape, for example, or an interdental brush, something like that. I'm not going into that today, but I am going to be doing that in an upcoming video. So subscribe me and keep an eye out for my interdental cleaning video, which is where I'm going to go through lots of different methods for cleaning in between your teeth if flossing isn't the one for you. Keep an eye out for that video. If you find that your floss is tearing, when you're, putting it in a certain area, it actually shreds and actually tears, sometimes even snaps in half in a particular area, it could be that there's a problem in that area and that you need to see your dentist about it. Please don't panic. When I say problem, I mean you might have an overhanging filling, or like a sharp edge on a filling or a crown or something like that just needs smoothing off. Or you might have a piece of tartar build up on, in between those teeth, which is sharp and is catching on that floss. So these are things that can be fixed. So don't worry, but let us know and we will fix it for you. If you ever get your floss stuck, if you can't get it out again, or if it has torn, the best thing to do is to let go of one end and just pull it out. Okay, don't try forcing it out, particularly if you're flossing around a crown or a filling. If it gets stuck, don't force it out. Just let go, pull it out gently. Okay, that's the best thing to do. Probably the second most common reason why my patients tell me they don't floss is because their gums bleed when they floss. But this is why we need to floss. Our gums bleed in response to plaque bacteria. So if you're flossing and your gums start to bleed in an area, it's indicating that there was plaque bacteria in that area that was irritating your gums. So if that area is bleeding, you need to floss it more. And I know that's probably not the advice you want when you say, oh, Leanne, my gum's bleeding. And I say, well, floss it more. It's like when I complain about being fat and people say, oh, do more exercise. And I'm like, well, excuse me, I did not want a solution that means I have to do stuff. Thank you very much. But, that's life, I'm afraid. But the good news is, with the flossing, if you really stay on top of it, if you really get in there, do a good job of your flossing, you will see results in just a few days. That bleeding will start to subside and eventually disappear, hopefully within about a week. But if you do find that the bleeding is consistent, if it's not going away after a week or two, just pop in and see your dentist just to make sure that there isn't anything else going on there. Now, since we only need to floss once a day, you can floss twice a day if you'd like to. You don't need to floss more than that, you're just showing off. But once a day is fine. I would recommend flossing of an evening. This isn't a documented, researched recommendation, it's just my recommendation, based purely on the fact that, we've been eating during the day and, there's that build-up of plaque and food that we need to remove. Also, most of us, depending on obviously your work life, your home life, most of us have more time in the evening, so we've got more time to focus on doing our careful C shape and our careful scooping and focusing on the areas that have been bleeding, and then being all proud of ourselves and admiring our smile in the mirror. So it's nice to have that extra time. So if you do have more time in the morning, then that is when I would recommend to do your flossing. And just before you crack on with your brushing, the last thing, I recommend having a really good rinse, like a really good rinse. Again, this isn't documented, researched advice, it's just my advice. So I find that when I'm flossing, sometimes I might loosen the plaque, I might loosen a bit of food here and there and not quite, get it out. But you can't always see if it's, if it's at the back here or if it's back there. You can't see that you've, loosened it and left it behind. So I like to just get some water in my mouth and just have a really vigorous rinse, like really throw it around in there. Close your teeth together, push the water between the gaps in your teeth, and then spit out into the sink. And I think that way you're more likely to remove, all those little bits that you might have, like I say, loosened and left behind. It just has a little bit more of an effectiveness to your flossing. Trust me, give it a try. Okay, so we finished flossing, so now we're going to move on to the second of my 3 products, which is toothpaste. Other brands are available. So many toothpastes on the market. We're literally talking hundreds, if not thousands, of different toothpastes available because they all have different specialities, so such as whitening or enamel care, things like that. I will do a video specifically on toothpaste and which are the best for your needs. So subscribe me, keep a lookout for that. But for now, just for a general day-to-day toothpaste, all you need to be looking for is that it is a fluoride toothpaste. As long as your toothpaste contains fluoride, you're onto a winner, it's fine. Also, regarding sort of different age ranges for your family, anybody over the age of 12 can use an adult toothpaste, unless told differently by your dentist. So children under 12, you need to look out for their specific age ranges, which is labelled on the toothpaste. And now we're ready to brush. You've got 2 options for your brushing, either an electric toothbrush or a manual toothbrush. Regardless of which you choose, you're going to need a medium bristle toothbrush. I've seen a lot of videos recommending soft bristle toothbrushes. I disagree. Unless, of course, you have been specifically advised by your dentist or your dental hygienist to use a soft bristle brush, in which case, of course, that's absolutely fine. And that may be the case if you've got abrasion, if you're brushing too hard, or if you've just recently had oral surgery. So always follow the instructions of your dentist and completely ignore me if that's the case. However, everybody else, just for normal day-to-day cleaning, medium please. The hard brushes are no good for use in the mouth, full stop. So you can use them for cleaning your taps, for cleaning your boots. You can use them for cleaning your dentures, as long as you don't clean your dentures in your mouth, which you shouldn't be doing. Otherwise, please don't, you will hurt yourself. One question that I get asked a lot is, should I switch from a manual toothbrush to an electric toothbrush? This is probably the point where I'm going to get told off, because the answer isn't always yes. For some people, absolutely, you know, an electric toothbrushes, studies have shown they are more effective than manual toothbrushing when they're used correctly. They are awesome when they're used correctly. If I have a patient who has been using a manual toothbrush for 40 plus years, they're comfortable with it, they know what they're doing, their plaque scores are good, they're doing a good job, but they're like, oh, should I have an electric toothbrush? Why? If it's not broken, don't fix it. If you're doing a good job with a manual brush, I'm not in a rush to move you onto an electric. I've even had situations where I've encouraged people to move onto an electric toothbrush and they've come back, 3 months later doing a worse job than they were doing with their manuals. Your dentist or your hygienist, we will let you know if you're doing a good enough job. And I'm not always going to push you to get an electric if I don't think that it's necessary, is basically what I'm trying to say in a very roundabout way. I'm going to start with a manual brush because, like I said, I'm not keen to discourage people from using them. And I'm going to start by demonstrating on my model. I am also going to demonstrate in the mouth. So for all those people out there that I know hate being shown things on models, they're like, I can't hold my teeth in my hand. I'm going to do it on myself. I feel you. I'm there for you. I'm going to do it on myself as well. But for now, I'm going to show you on a model. Just I can get closer. As I'm sure you already have been told, you need to point your toothbrush at a 45-degree angle. In case you don't have a protractor handy, that basically just means it needs to be on your teeth, but it needs to be on your gum as well. So that's what we're getting at. And you need to be brushing in circular motions. So hard enough that you're actually doing something, but not so hard that you're making your gums sore. If it's sore, you're brushing too hard, okay? So the purpose of this movement is that you're brushing the teeth and the gum. See? Tooth and gum, tooth and gum, tooth and gum. See, as a dental hygienist, a lot of my job is cleaning people's teeth, and honestly, most of what I remove is on this gum line. So it's here where the tooth and the gum meet. People get these little rings around here, particularly on the inner surfaces, if I'm honest, but just generally as well, this little area here. So try not to leave it out, because also, if you're getting plaque and tartar sitting on your gums, your gums are going to bleed. They're going to suffer. So you want to take good care of your gums. There we are. So you want to do that all the way around, and then flip-a-roo over to the inside. And then when you're brushing on the inner surfaces, you have to hold your toothbrush a slightly different way. It's sort of almost vertically, because if you imagine, I'm lucky I'm holding this in my hand, but you would have lips here, cheeks here, a tongue in here, you've got things in your way. So you need to be angling it sort of like so, more vertically, but continue with that circular motion. Make sure you can still feel the bristles all the way down on your gum line, because it's harder to see what we're doing on the inside. So you might not be able to see that you're cleaning the gums. So just make sure you can feel your toothbrush bristles on your gums. So all the way around to the other side. This area in here, so behind the bottom front teeth, so many of my patients complain to me that they can't keep that area clean, and the tartar builds up really quickly. You literally have to hold your toothbrush dead vertical and brush as low as you can. Again, make sure you can feel the bristles on your gums, but also make sure that you're not making them sore. If they're sore, it's too hard. But just nice circular motions around that area. Okay. And that should prevent you from getting that build up behind there. Good. And then once you've done front and back, you can go ahead and do the biting surfaces. So here, And it's okay here to brush in sort of a back and forward motion because you don't have any gums there that you're in danger of receding or damaging. So you can just give them a nice back and forth, remove any food, any dirt, anything like that. Wonderful. So top teeth, I'm going to demo in my mouth. Okay, so one top tip from your dental hygienist. When you're brushing your very back teeth, particularly on the front of your very back teeth, close your teeth together like this. Don't try to do it with your teeth open like this. Because what that does is when you open your mouth wide, your cheek and your muscles here are tight against your teeth. So it makes it hard for you to get your toothbrush back there, and you'll end up just sort of banging against your cheek and missing the teeth at the back. Whereas if you, like this, see, you can get all the way back. Particularly if you have wisdom teeth, because wisdom teeth are a pain, but this will really help you to get all the way back there and keep those nice and clean. So, to the back, nice circles, teeth and gone, teeth and gone, teeth and gone, all the way around. When I get to the front, I swap hands. All around, teeth and gone, teeth and gone, teeth and gone. To the back, and then flipperoo, like on the lower arch. Nice circles, almost vertical again, same as the lowers. Vertical for the top, for the front rather. Hoof and gone, hoof and gone, hoof and gone. All the way to the back. And then for the occlusal surfaces, the biting surfaces, a little back and forth is fine. Now I realise I didn't put any toothpaste on my brush, but when you do, you need a pea-size amount. And after you've finished brushing, the advice is to spit your toothpaste, but don't rinse your mouth out. It's an unpopular opinion, apparently, with most of my patients. Are like, huh, what? Like, that's not what I've been doing my whole life. Same. I always used to rinse after I spat my toothpaste out, but apparently no, the guidance is that we spit out the excess. You don't have a mouthful of foamy toothpaste, but then you leave what's there, you just leave it on your teeth. Just so that the fluoride in your toothpaste has more time, to do its thing, work its magic, and that's pretty much the entire reason. Give it a try. It's one of those things that when somebody says it, you think, oh, that makes sense, yeah, I'll try that. The electric toothbrush. This one is an Oral-B. Other brands are available. It's got a round head and it oscillates, which just means that it spins, and that's part of the way it works. Some of the other toothbrushes that are available, such as but not limited to Sonicare, they don't look anything like this. So they've got more of like a longer, more oblong head, more like a manual toothbrush, and they don't spin, they don't oscillate, they sort of have more of a sweeping motion, but they are used in the same way. So if you don't have this electric toothbrush, if you have a different one, don't panic. Don't think that this video is no good for you, because they're used in the same way, so it's fine. Your electric toothbrush, very similar to how you use a manual brush to begin with. Let me get you back in focus. So again, you still want to angle 45 degrees. You still want to be on the tooth and on the gum, but the difference with an electric toothbrush is the brush does all the work for you, so you needn't do these circular motions because the brush is going to spin, it's going to do it for you. So I'll turn it on for a sec, but it's going to be loud, so I won't leave it on the whole time. So you just hold it on the tooth, move on to the next one, move on to the next one, move on to the next one, and so on. So because the toothbrush head is spinning, you don't need to do any of the action, like I said. So you just move it along. So you give it a few seconds on this tooth, move it to the next one. And that is how you use your electric toothbrush. One tip, put the toothpaste on your toothbrush, put it in your mouth before you turn the brush on. If you put your toothpaste on, turn the brush on outside of your mouth, you're going to just paint your bathroom with toothpaste. So put it in your mouth first. But otherwise, yeah, the same as your manual brush. You follow around the front, and the angle is the same on the inside. You're still going to need to get at that sort of vertical angle in order to reach that gum line. And again, dead vertical for behind these front teeth and all the way around. But with the occlusal surfaces, again, you don't need to scrub, you don't need to do anything. Again, you just hold the toothbrush and let it do its thing. Like so. So I'll show you a little bit on me for the model haters. So put it in my mouth first and turn it on. Whoa, that feels really weird with a dry toothbrush. So I'm going to stop there. But you get the idea. If you don't get the idea and you want me to do more on this, in the comments, let me know, please. So we've done our flossing, we've done our brushing, and that's it. We're all done. I told you it was simple. I mean, if you're able to floss like that once every day, brush like that twice every day, you'll be doing an excellent job of keeping your teeth clean and healthy. But do I need to brush more than twice a day? I hear you ask. After every meal you cry? No, please don't. You don't need to brush after you eat. You don't need to brush after lunch, etc. Mainly because there is such a thing as overbrushing. And so you're at higher risk of things like acid erosion, tooth wear, stuff like that if you're brushing too many times a day. If you are concerned about sort of the acids and sugars in your mouth after you eat, or if you just like that nice clean feeling after you eat, sugar-free chewing gum is a good option on the move, or else an alcohol-free fluoride mouthwash is a good option. So just have a good rinse with a mouthwash after you eat, and that is enough to neutralise any acids in what you've eaten and give you that nice sort of clean feeling. And you can get the little travel size bottles that you take on holiday as well if you want to pop it in your bag for when you're out and about and stuff. So that's a much better option than the brushing, because then you're not in any risk of over brushing or doing yourself any harm. I think that's everything. So I'll look forward to seeing you in my next video, and until then, keep smiling.